so much, David and Lars and everyone, for hosting us here at the seminar on humanity and health. It's a pleasure to join the community on humanity rising. And my presentation today is really a call for help. So believing in co-creation. I'm bringing you a concern that I've had in my work on health literacy. So for the last 10, 15 years, I've been involved in health literacy. So that's the about the knowledge and motivation and competencies to find and understand and evaluate and use information to manage and cope with health issues, both at individual level and organizational level in communities and at societal level. So I do advice for policy, for NGOs, teaching also. And in my work, as I say, I often get the question, while we try to bridge the gaps of inequity through health literacy, there is also a concern that we don't always do what we want to do, and that instead we actually widening the gap, especially through the language that we use. And a lot of the work is, of course, with vulnerable groups when we talk about inequity and looking at some of the issues related to human rights. You see a long list of groups that we care about and concerned about. So women, children, migrants, displaced people, stateless people, minorities, indigenous people, disabled people, people with different diseases, Romas, and people with different sexual preferences. And in my work in health, we often, categorize people as being low education, poor, homeless, addicts, or unemployed. And when we try to describe these groups, we use all kinds of labels, such as being vulnerable, hard to reach, excluded, underserved, hidden, disadvantaged, on the edge, and so forth. And while we try to be politically correct, sometimes this kind of labeling has the opposite effect. Often they would say, we're not vulnerable, you're making us vulnerable. The system is making us vulnerable. It's not us that are hard to reach, it's the system that is hard to reach. And it's not us being so, it's you or the system not serving us well enough. So we question it, and in our efforts of trying to reach and trying to build bridges, we actually sometimes widening the and exclude even more just by the way the terms we use, and because we make those people then stand out. Other examples of this include, we talk about people-centered health, and people say, well, we don't, patients or these groups that we talk with say, we don't want to be in the center. We want to be part of the circle. We want to be part of the crowd. We want to be recognized as equals in this dialogue or in this work that we have. When we talk about giving voices to the voiceless, this is also a sentence that's being used very often. The people saying, well, we always had a voice, you're not giving it to us, we had it. How can we make a way where we actually, in our attitudes, in our way where we talk, become much more inclusive, instead of actually discriminating, even it's not really our intention to do so. So some of the alternative levels, but I haven't been able to find much. I've been trying to, look through the literature, trying to find guidelines, and people say, well, what about priority groups? What about local communities? But is that the right term? So I'm looking to this group. I think this is a unique opportunity to hear your advice to me, to my work, to my colleagues. What kind of wording can I bring on. Also, I'm not a native English speaker. I'm Danish, and we have some of the same issues in Danish in my own language. So I'm really happy now to hear your advice. I think, of course, what we should always do is try to acknowledge that groups are not homogeneous. We need to respect diversity. Some of the other speakers said that as well. We need to listen, and we'll be much better in listening instead of just telling people what to do. We should enhance, co-creation and tailor communication and services to people's needs, and not just take them for granted, to know that we know what is best for them. And also, whatever we do, try to facilitate the work that we do with respect to languages and cultural sensitivity. And really, I think one of my major concerns is also a lot of the things that are put in place are project-based. It doesn't really resonate with the sustainability that we want to build up. It's always kind of pilots, and it always ends when the money is not there. So can we start building new initiatives already with the long vision built in to our work, rather than this short-sighted? That would be really helpful. So let me finish this call for help from you with also a wish that we could try to humanize health, working for the right to be and the right to become and the right to belong. So I look forward to hear your ideas and to bring me to a higher level on how we can embrace everyone to the work in the work that we're doing. Thank you.